Good evening, and thank you for joining us. On a day when Ontario is enjoying the benefits of the second phase of reopening, the province has announced it's expanding the number of people we can have close contact to. Chief Medical Officer Dr. David Williams says that means physical distancing does not have to be practiced between members of the same so-called social circle. This comes as Ontario is reporting its lowest number of COVID-19 cases since late March. Colin DeMello reports.
It was perhaps one of the most difficult parts of the pandemic. COVID-19 forced families and friends to remain distant and separated for months. But now, as the province gets a better handle on the virus, the government is changing the rules.
This change will expand the number of people who we can come in close contact with who live outside our homes.
In the province of Ontario, you can now gather with up to 10 people at a time, as long as you remain physically distant from one another. But starting today, you can also create a social circle and actually interact with the people inside of it.
Think of your social circle as the people you can touch, hug, and come into close contact with as we continue our shared fight against COVID-19.
Okay. The expanded social rules come as major portions of the province entered stage 2 today, allowing people to get haircuts, enter shopping malls, and even dine on a restaurant patio.
We wanted to show support for the local restaurants. They've obviously had a tough time, and we wanted to show our support.
The reopening, however, excluded millions of people from the Greater Toronto and Hamilton area, many of whom decided to simply hit the road.
I just wanted to get away, tired of the city stuff and what's going on, so just want a break.
The province as a whole has seen a dramatic improvement in its COVID-19 fight, and so the government says reopening the rest could be coming soon.
Especially if we continue to see these downward trends across the province.
In the meantime, larger social gatherings and family interactions will start immediately and province-wide. The Premier says you are not going to be watched.
The social circle police aren't going to be knocking on your door. We trust you're going to be doing the right thing.
But sticking with the rules, health officials say, will help the entire province get past the pandemic.
The Thunder Bay District Health Unit is reporting 2 new cases of COVID-19, a woman in her 50s from the Thunder Bay area and a man in his 80s from a First Nation community are both listed as hospitalized. In both cases, the exposure to the virus has yet to be determined. Meanwhile, the 2 health units in this region are no longer advising a 14-day self-isolation for people who travel outside of northwestern Ontario. And while travel does increase the risk of COVID-19 being brought back to the region, Thunder Bay's medical officer of health says that risk is getting lower and lower. Ryan Benazzo reports.
The number of new COVID-19 cases continues to dip across the country, and the Thunder Bay District Health Unit is now offering a more optimistic view of domestic travel.
As we get lower, it's actually more reasonable or more feasible that we could travel with less risk of bringing the virus back.
The health unit is no longer advising those who travel within Canada to self-isolate for 14 days. Instead, they should simply monitor for symptoms and isolate only if they begin to feel ill. This as new cases in Ontario dipped below 200 on Friday.
That was really exciting to see. We could see that Toronto and the GTA is getting their spread under control, very much so. So we see that. We see that in Quebec as well.
Federal Health Minister Patty Hajdu has grown increasingly optimistic as well.
We're much better at understanding what this illness looks like. We're not afraid now, especially in Ontario, to test people, even asymptomatic people. So there's a very good testing strategy coming together for Ontario. And we have a much more comprehensive approach to contact tracing.
But that doesn't mean we're out of the woods, and people still need to take precautions.
The virus is still here, and what we all need to be doing is maintaining those measures that we could do as individuals or as families to, maintain that distance between our, 2 meters, stay home if you're sick and get tested.
And if the numbers do rise, DeMille notes we have the capacity to handle that.
We're not overwhelmed right now, nor is the health system here.
Ryan Benazzo, TBT News.
Local barbershops and salons were very busy today as Thunder Bay entered stage 2 of the province's reopening plan. Anyone inside a salon is required to wear a mask at all times, including customers. And as Avery McRae reports, anyone looking for appointments may have to wait quite a while.
I'm sure there'll be a lot of disasters out there. I've seen a few around town, so.
The scary days of home haircuts are coming to an end as the majority of local barbershops and salons reopened today, including Sam's Barbershop on Algoma Street, operated by 83-year-old Sam Migliazza, who has been in business since the early 70s. Customers and staff are now required to wear masks while inside the shop and during the appointment. Officials at Trends Hair Studios say bookings are more spaced out and stations are double sanitized in between sittings. Customer Corey Anderson appreciates the measures taken to keep himself and others safe.
Well, they run a tight ship here, so I'm not only really happy to be here and everything like that, but it's evident that they're taking the precautions and everything really seriously. They've gone out of their way. They're doing a lot of cleaning, making sure that people are keeping good distance and everything.
Just social distancing. We want to keep that strong because you know what? If we keep this all like this, it's going to be better for Thunder Bay. Small community, you don't want the spread to happen.
With social distancing measures in place, the barbershops are taking less appointments in a day than they would before the pandemic began. This has led to a backlog in reservations as long as 2 weeks for people to try and fix their do-it-themselves haircuts over the pandemic or clean up long messes like this. The barbershops assure that it will take time, but they will see everyone.
We are quite booked up for the next month, just because of the fact that we are taking less clients, so we can't get everybody in at once like we used to.
We try to get in as many as we can, but the reason you can't have too many people in here, so we're limited how many we can get in at a time, so we're trying to spread them out.
I think once we get our first clients in, I think eventually it'll start to smooth out.
Customers looking for beard trims and other facial groomings will have to wait a little longer before booking their appointments. Services that tend to a customer's face are still prohibited by the Ontario government. Avery McRae, TBT News.
Today also kicked off restaurant patio season in Thunder Bay following the 3-month COVID shutdown. Several local patios opened under strict guidelines that includes face masks for staff and proper social distancing, with fewer tables and more space between customers. The Foundry, Nook, the Red Lion, and Madhouse were just some of the restaurants that were ready to open up their patios following Monday's Stage 2 announcement by the Ford government. The owners, staff, and customers we spoke to were all very excited to get back to business and back to enjoying some form of pre-COVID activity and normalcy.
Oh, we're beyond words. It's so exciting to be back here, serving our community and bringing great food, drink to them. So we have quite a few protocols that we've put into place to maintain safety, social distancing, lots of hand washing stations and sanitizing. We have reduced the amount of tables to allow for the spacing to be proper between people. And we're all just taking extra care and making sure that, we've got all the guidelines and we're following them to the T.
It's been easier than I was expecting. There was a few sleepless nights, there were some long days this week, but everybody's pretty game, and all the customers have been super polite, and the staff is most of them are just so happy to be out of the house, right? And the cooks that have been here working for me through this are just happy to have customers to serve again.
Most restaurants were filling up fast with reservations over the weekend, and some even booked into next week. City Council will be discussing a potential fast-tracking of the pop-up patio program on Monday night for restaurants that don't have patio space. A group of hospital workers rallied outside the Regional Health Sciences Centre today asking for the same $4 pandemic pay top-up that their colleagues are entitled to. An estimated 2/3 of hospital workers have been left out by the province. Phlebotomists who take blood, x-ray technicians, pharmacists, and social workers are just a few of those who don't qualify for the pay raise. OPSEU Local 715 President Jesse Kozlowski is a biomedical engineering technician who maintains and repairs vital hospital equipment. He says he and his members face just as many of the same risks as any other frontline healthcare workers do.
We're always the forgotten frontline healthcare. Year after year in bargaining, there's never mentions of a lot of our professions. It's always nurses and doctors are always first and foremost when it comes to a hospital. And they do great work, but we do great work as well, and we're part of a big team here.
He admits the pay disparity has caused some resentment among hospital workers. Similar rallies have been happening across Ontario. OPSEU's national president has also called on the federal government to step up and fill the gap left by the provincial funding program. People in Thunder Bay will soon be allowed to visit their family members who reside in long-term care homes, but a union leader representing staff at some of the local homes is opposing to the government's move. As of June 18th, long-term care homes will start to allow outdoor visits of one resident per week, and retirement homes will resume indoor and outdoor visits where social distancing can be maintained. This comes following a mandate announced by the Ford government yesterday. The president of Unifor Local 229 says this is far too soon for facilities to be opening.
Personally, I'm very concerned. We're on conference calls with our colleagues across Ontario weekly, sometimes multiple times in a week. We're hearing the stories that our members are dying, are significantly sick, and the horrendous stories that we're hearing in long-term care for people who are suffering with COVID. So if it can be prevented, and if we can buy a little bit more time and ensure that there is more testing happening regular here. The Ford government said they wanted to see 20,000 tests a day. We were very, very far behind testing in Ontario.
Retirement and long-term care homes can operate under these new stipulations unless there is an outbreak. The province is lifting the 30-day supply limit on prescriptions starting on Monday. This means people can now get 100 days worth of medicine at a one time from their pharmacy or physician. A limit was put in place in March to ensure there was enough supply of medications in the province amid the pandemic. However, people are still being urged to not stockpile their prescriptions. 2 residents of Muskrat Dam First Nation need to be airlifted to Winnipeg after a fire engulfed their two-story home yesterday. The fire also caused damage to 2 nearby homes. Both the husband and wife sustained second-degree burns to their hands, arms, and torso. The situation was further complicated with a community-wide power outage and bad weather prohibiting the use of an air ambulance. The mayors of Oliver, Papoonge, and Conmee say there are pros and cons to a proposed merger that was announced yesterday. 2 rural municipalities have worked very closely together over the years, and they're now studying a more permanent connection. Cole Promain has details.
For the past 2 decades, both Conmee and Oliver Papoonge have worked diligently together to try and reduce costs while simultaneously trying not to sacrifice service to their residents. The longtime mayors of the 2 communities now believe a merger might be the next best answer. In the next 2 weeks, a consultant will assess the benefits of a merger, and Kevin Holland and Lucy Kloosterhouse say there is a chance for growth.
We treat this, I run this as if it's a business, and businesses grow, and the atmosphere in the world changes on a daily basis, and you have to keep pace with that. And we're at a point now where community has grown probably as far as it can grow on its own, and like all businesses, that you either stay how you are, or you look at merging with somebody to take you to that next step.
This merger has to come with benefits for all, and that's not just financial. There's assets to be looking at, reserves, which are of course financial, but we don't want to see people losing their jobs, and we have no intention of that happening.
Conmee had a population of just over 800 people in the last census, while Oliver Papoonge had nearly 6,000. While the mayors of both municipalities are optimistic about the proposal, they are also well aware of the concerns of the members of their communities.
Is there going to be a tax increase as a result of this? That's going to be the number one concern. The second thing will be maintaining level of services. They're not going to want to see their service level drop. So these are the 2 biggest priorities that we'd be looking at.
Those are all going to be in the hands of the consultant. They'll be given all the information from both administrative departments, both from Conmee and from Oliver Papoonge. They're going to assess them, the financial and all other sections of this merger, and they'll come back with the report, and that's when we're going to look at it and find out what they are.
Oliver Papoonge itself is a result of an amalgamation around 20 years ago. As of right now, this merger is still up in the air, but if it were to progress, it would likely take at least a few months to finalize the plans. Cole Promain, TVT News.
Grand Portage Lodge and Casino has pushed back its planned reopening by a week. It's now set to open June 29th, regardless of whether the Canada-U.S. border reopens or not. The reopening includes the casino, hotel, Island View Dining Room, and Antlers Lounge. All will be operating at 50% capacity with extra sanitizing protocols in place. Guests will be asked to social distance while inside and will be required to wear masks and gloves, made available for free of charge. Smoking will now be banned on the gaming floor and in the lounge. Grand Portage originally planned to open on June 22nd, a day after the border restrictions were expected to be scaled back, but it appears the border may remain closed at least until late July.
Well, Fiona, weather-wise, it's been a work week to forget, that's for sure. But thank goodness it's Friday, because we're finally starting to see the tables begin to turn a little bit across the region.
Very slowly, but yes, definitely an improvement over the last 20